Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
The one act play, just like we say, and so we have our lines, we rehearse our lines, we know our lines, and if they say this, that, or this, then we go this way, and it's very simple. We can have a predictable experience. When you walk in, it should smell a certain way. It should sound a certain way. We have all these things that people, I love when they notice that and they say, the experience here is just fascinating.
This is Dr. Bruce Baird with the Productive Dentist Podcast, and I've got the pleasure of having one of my great buddies for many years, Dr. Jackson Bean, with me. Jackson, thanks for joining us.
Glad to be here. Funny, 20 years later that we're reconvened on these terms. It's neat.
Yeah, it is crazy. I tell you what, Jackson was actually an associate in my office, I think started in like 2022 or 23 or something like that.
02 or 03, yeah.
Right. Yeah, sometime. I mean, we're talking years ago. And I have to say, you were one of the most productive associates coming right out of school that I had experienced. And I'd had a few associates before you, but anyway, but thanks for being on with us. And Jackson, for those that don't know him, he has been doing, tell us about your mentoring program that you've been doing, Jackson.
COVID changed the school landscape to where now a dental school education is all over the place. I mean, rarely do people get the education you and I got where 40 crowns. And I mean, that's just unheard of these days. So now graduates come out really some are very prepared, I don't doubt, but most are grossly underprepared for private practice. And so getting them to get confident in doing what we do is quite a hurdle. And so I just thought, I'm helping people anyway. Jennifer said, on Dental Town and all this stuff, you're doing this anyway. Why don't you just start charging for it? And I thought, well, and so I just started this mentoring with a few folks, and it's grown to a nice size group. I haven't done any advertising yet. I don't want it to be too big, but I'm just helping those new grads get some reps, and then we have an over-the-shoulder program where they come and they actually put in their first implant and prep some crowns. And it's neat for them to get that experience with you looking over their shoulder.
Oh, absolutely. I just love doing the over-the-shoulder programs. We did quite a few in our office over the years. And, one of the things about that really it impresses me about how you handle things. We've been talking about Clinical Calibration Institute, and you're going to be one of the instructors with us on that program. And it's trying to get everybody on the same page, and not just your associates, but also your front desk, your chair sides, your treatment coordinators, and your hygienists. And how does that, I mean, I know you have a lot of tricks, and I want to find out about some of the things you do, but what are some of the things that you're doing currently with your team? And I know you just had one associate leave and another associate coming in. So you're in a mode right now of probably training and teaching and explaining and everything else, but tell me a little bit about what you guys do.
Well, you said it there. Getting everybody on the same page. Calibration is critical to success because, and by the way, I had a really great teacher. So if some of this sounds familiar, it's just a ripoff of you. So it's right. We're just a accumulation of those that have spoken into us, and I'm proud to say you are 90% of that and a big influence, and that is just transitioned over to the team as well. So I train. We're the one act play, right? We're the one act play, just like we say, and so we have our lines, we rehearse our lines, we know our lines. And if they say this, that, or this, then we go this way. And it's very simple. We can have a predictable experience. When you walk in, it should smell a certain way. It should sound a certain way. We have all these things that people, I love when they notice that and they say, the experience here is just fascinating. We're a 5-operatory office out in a rural setting that's not wealthy by any stretch. 68,000 is our household income, but we produce a lot because we have this predictable experience. And when we're talking about fear around a dental appointment, and it's a very personal thing to have a couple 100,000 RPM spinning in my mouth. I got to see you. I got to see that you're bright-eyed and weren't at the club all night last night. I mean, it's a personal thing, that trust. And so being able to repeat that trust and deliver that trust every time is huge, and people will pay for that. Not that we are we probably are the most expensive in town. I don't know. We're not expensive, but it's value, right? And we just try to provide that experience and value. And so getting a team where we can provide that, the comfort menu, do you want a neck pillow? Do you want all that stuff, the glasses, all that stuff? It's neat and it's predictable. And so we're the McDonald's, but we just don't have the bad hamburger. We're trying to be predictable in our delivery.
That's hilarious. I mean, that is so true. I mean, what we do is, we want to make people feel comfortable. And I finally felt like, and for those of you that have heard the podcast over the last 6 or 7 years, that we're known as being the most expensive office in Granbury, but also the best. And, so our new patient flow comes in, and I think a lot of them already know that, or they've heard that we're the best. And okay, it's going to cost me, but I feel like I'm going to pay for something that's worth it. And I think that's what you're finding out now, as you've gotten to a point to where you said, I'm not sure if we're the most expensive. Well, we probably are, but still seeing new folks, and they're coming in and they're saying yes to treatment. How do you feel? How do you prepare your team as part of this, getting patients to say yes? How do you prepare them along?
Great, Bruce. And to answer the last question more appropriately, that's 90% of it, because if you look, they say statistically, the team is responsible for 85% of the patient interaction. 85% of their experience is the team. We're only 15%. That's okay. Wow. But that shows how much time we should be spending with that team. And so one of the things we do is a quarterly team meeting at our house. And so we have the pool and all that stuff, and it transitions there sometimes, but it starts off as a serious meeting in the great room in there. And so we have Kahoot, we have trivia. And so I ask them, the funny line is, any day that ends in Y is trivia day at our office. And so I like to, just quiz them. Why are we doing this? And what's the point of a buildup? Why do we do that? And so I'm just, talking. We're just talking, passing the time, because it's a technical exercise at some point, right? We're the crown prep. We're just doing it. You don't have to think, hey, let me put a moderate chamfer on we just do it. So we're just making conversation. The patient kind of entertains them, and the team is like, well, they can answer. If you ask Sarah if Neodent makes a 4.3 millimeter in a drive model with a, MUA with a 17 degree, she'll tell you, well, in the 2, 3, and 4 tissue heights. I mean, she's that good, but she's worked with me a long time. So the trivia puts a fun aspect to it. So we have prizes and we put them on teams. I like a front person. Not that we name people after furniture, because we do, right, in dentistry. But I have someone from the front teamed with someone from the back, and that's a team. And then they're on the big TV board, and so they're trying to answer the fastest. So it'll be questions like, what are the following are abutments? And they have locator, custom. We have the different abutments, and they have to answer that. And so it'll be insurance questions, things in the patient delivery that we want them to understand. What is the best way to answer this? And so just silly stuff like that we may not think much of, but then the team knows, hey, here's what they expect. Here's what, you would say, inspect what you expect, and trust, but verify kind of thing. And so that's what we're doing, is just laying the foundation for them to have, okay, I remember this on the trivia thing, and here's what we're supposed to say. And it's a great foundation, gives them comfort in knowing we're going to deliver that predictable experience.
Yeah, I mean, being in a dental office when you don't really understand, your front office could very easily have come from the bank. They know banking, but they don't know why we do what we do. And they may be a great communicator, but they still don't know why we do what we do. And I really believe the way you're doing that is just brilliant. And your production numbers show it. I always say I've never worried about money in dentistry. I only worry about 2 things.
As a clinician, are you frustrated with the high-risk patients that are in your practice right now who are not following through with your perio protocol? If so, we can fix this problem together. The Clinical Calibration Institute, powered by PDA, is hosting a free live mastermind featuring Dr. Tanya Dunlap of PerioProtect September 30th, where she will teach you how to master biofilm control, pinpoint ideal candidates, and learn how to simplify results with the RX tray therapy. Go to clinicalcalibration.com right now to register for this free live mastermind event today.
One is to take care of our patients, and number two is to reach my goals. And if I do reach my goals and I haven't taken great care of patients, guess what? I quit reaching my goals at some point. So that's kind of what ends up happening. But I do know that we have it. I can hear my dog going crazy. We must have the Amazon person here or something. But anyway, sorry for the little bit of disruption.
No, it's funny, Bruce. So many parallels because I've been emulating you for so long, but taking incredible care of that patient in that chair is our focus at all times. And so, are we taking incredible care of that patient in that chair? And that's where that's where it all ends. And so, if we're doing that, then I don't really care about whatever bad news you've got to tell me. Let's just be sure while they're here, we're going to take incredible care of them, and the rest is going to work out. So I use a lot of your sayings. The numbers just work out if you focus on the patient, and because it's true. I mean, it's really true. I mean, if you just take incredible care of that patient, that's really all your focus should be. Then afterwards, we'll deal with details. But, I don't care about, the details in the midst of that treatment. And it's funny how it works.
It's really amazing. And, have you noticed, I mean, I'm sure you have, I mean, you've had several associates, but, and the concern of those folks coming in and not really having maybe the education that they could have had. And what ends up happening, at least what I've seen, is they get into practice, whether it's in a DSO environment, whether it's in a dental practice, whether it's in their own practice, and they look to the insurance companies to tell them what is right and what's wrong. And how to deal with that? I mean, it's a joke because insurance companies, you know what I think about insurance companies, I hate them. And it's just a method of payment. It's not a method of treatment. But what things, because you'll have people come in and say, hey, I want to, I've got insurance. Okay, well, great. What do you tell people when they come in and they seem to be really on the insurance bandwagon, either as a dentist or as a patient?
Well, it's funny. You remember your old trick with the piece of paper and you write oral health. And so I love the physical separation of that. So I write oral health on one side, I write insurance on the other, and I physically tear them in two. And I say, I'm going to take your insurance and I'm going to put it right over here. Now we're going to come back to this. We're going to talk about this, but right now we're going to focus on oral health. Is that okay with you? We're nodding. And so the team has to just see that a few times, and the associate has to firmly believe what we believe. Insurance, let's be honest, they're maybe reporting to stockholders, but they're worried about the corporate jet. They're worried about their office upgrade they're doing. And look at the bonuses of the CEOs on some of these top insurance companies. It is absurd. And so the only people that should be making more are dentists, right? And so no, but it's, the bonuses they get are just crazy. And so you think they're worried. They're not worried about if you're hurting this Friday afternoon. I'm worried about if you're hurting this Friday afternoon. So we can either use that as a guide, but we should really worry about what's going on in your mouth. And I'm telling you, when you put that iTero scan on 40 something inches in front of their face and it's zoomed in on whatever tooth, there's no convincing them of anything. They're wanting, when can we get that out of my mouth? They've never seen it from the tongue side out. And I love that one of yours too. We're going to study it from the tongue side out. But you think, but you've never seen from the inside of your mouth out. Well, now we can. And it's fascinating viewpoint if you haven't seen it. So we educate on, it's a method of payment. It's a coupon. It should be called dental coupon, right? Don't get me started as well. Dental coupon. Let's use your coupon. Let's maximize your coupon. But let's be honest. Your oral health is nobody's responsibility but yours. They do not care. They don't know what you have. They don't care. They care about the bottom line. And so focusing on your health is going, now that we know the link, I mean, spirochetes with dementia, type 2 diabetes, heart attack, stroke, Alzheimer's. I mean, it's serious stuff. When we see inflammation and we swab and we have spirochetes in there, we have a phase contrast microscope, we look and there's spirochetes, they see that those bugs on that are in, oh my gosh, it's serious then. And so it's just eye-opening that the insurance company doesn't care about that. So we'll use your coupon, and that's what it is, a dental coupon. But let's talk about what it takes to get you healthy again. And then we'll have a low monthly payment that works for your schedule and time and budget. But if we can figure that out, don't worry about the rest. We'll worry about the spirochetes. And it's funny, they just don't talk about it anymore after that.
People are coming in with already an understanding a little bit after being online and looking up stuff that their mouth is connected to their heart and connected to their brain and all of that. Are you starting to see that now? I was beginning to start to see it.
So Bale and Dunning, who you told me about the Bale Dunning method, there's a documentary, I guess, out, and it may be controversial because they misconstrue root canal as if you have a root canal, take it out or something like that. And they said, they did a correction, said that is not, it was taken a little out of context, but whatever that is, I haven't seen it yet, but people have seen that. If it's on Netflix, people have seen it. And so they come in with it's more serious now, and they know the red puffy gums. And I have a saying, I think this may be original. I don't have any 9-year-olds with red puffy gums. In other words, all my 90-year-olds, if you're 90 plus, you either have a denture or healthy gums. There is no in between. Now, in your 90s, you may lose dexterity but the point being, you don't walk around with red puffy gums and live a long time, period. End of story. That's it. I don't know what about the inflammation kills us, but something does. And so we just help them grasp onto that and make recommendations based on that. And few people go, well, after that go, well, if my insurance will cover it, then I'll do it. It's like, dude, we can't.
They forget about it. And Wade Kiefer, I was talking to Wade a week or two ago, and Wade said, and he uses his analogy because he had a heart attack at 37 years old, and he said, I have my genes have guided me in this direction. You have genes that are there are genes that cause tooth decay. There are genes that cause periodontal disease and all of this stuff. And he kind of takes it really into that level. And I'm like going like, wow, it makes us step back and understand that we are oral physicians. I mean, we literally, from a sleep apnea standpoint, from all of these things, it really is. We're the ones that are going to see these people and really can change their trajectory on their life expectancy.
Absolutely.
Crazy. I mean, it really is. So when you are going through and doing treatment plans, and I know, as you and I have talked before, when you have a new associate, their average treatment plan might be $4,000 or $3,000 or $1,000. And ours might be 12,000 or 15,000. It's not that we're saying you only see what you know, right? And so all of a sudden, this calibration, or getting people back in the day, we would go to study clubs. And as a young dentist, I would go and learn from a bunch of older dentists. Today, that can be done online. And it can be done over the shoulder. And so that's really where the Clinical Calibration Institute is really coming to the forefront. We have people knocking the doors down now, signing up. And I think it's like, I honestly don't know, so don't hold it to me, but it's like $450 or $500 for your entire team to learn. Front office is learning from front office people. Doctors are learning from doctors and associates, and hygienists are learning from Michelle, and and our oral systemic program, Kim Cooch on decay. So we've got, I think, some of the top people in the world teaching. Tell me a little bit, because I know that you are heavily involved in reconstructive dentistry and implant dentistry. Tell me your journey a little bit on that.
Okay, very good. So the landscape has changed a little bit in that now we have this weird one-off thing where people have been told they need all-on-4 teeth in a day when they don't. And it's unusual. Like, my favorite thing I do, Bruce, is taking a denture wearer, someone who's worn a denture 30, 40 years, and they hate it, but they've been told they don't have enough bone, and they believe that. They don't know we can use alternative sites and take that denture and throw it away and give them permanent teeth. You take a denture wearer for 30 plus years, you give them permanent teeth in one sitting, and you have changed their life in ways they just didn't think that was possible ever again. I had a 90-year-old once tell me that chewing replaces sex when you're 90. And I thought, well, okay. interesting. But he said, it's so gratifying to chew. And I was like, oh, okay, we'll just stop there, but it was funny. And I thought, you know what if that is true? I mean, if we've given someone a denture in their 40s, 30s, whatever, and now the rest of their life, they never get to chew again. You and I don't know what that's like, but that is a debilitating, it's a horrible thing. And it's nationwide, 30 million edentulous. Come on. That is a national travesty. That is unfortunate. And with a few implants strategically placed, people think all on four implant. No, 4 strategically placed implants into cortices, bicortical stabilization. We can give them permanent teeth that last the rest of their life. And of course, we don't say that. We say that last 20 plus years, and they do. It works. But you have to do these criteria. 4 implants in an arch and a permanent bridge, that's lunacy. All right. And Mish would have said that, you're not over engineering the foundation. Put in 5 or 6. Okay. Yes. Unless you know how the 4 should go. But again, there's this one thing. So people come in having been told they need all their teeth out. A guy today, he's missing 2 first molars. That's it. That's where the sentence stops. He's missing 2 first molars. They told him he needs all his teeth out. They're a little crowding and, some recession. But let's be honest, that's not need your teeth out. If you've ever we've been at the end point and you have no other options. You're going to wish you gave every tooth an opportunity to live. And it's not common that happens, but nevertheless, it happens. So we need to give every tooth that option to, give the patient the option to take great care of it. And if they don't, or can't, or have a dry mouth, or a situation, their risk profile is they're decay prone and they can't get out of that situation, then we'll go implants, of course. But let's not have it be this, everything's a nail when you have this hammer. And so we got this, people come in that want to talk to me about teeth in a day because they've been told they need it and they don't. So there's that wrinkle that's not like, they know what to expect. They've been told what clear choice 60,000 or something now. They've been told these numbers. Dallas, they're all trying to outdo each other. Atomic is $89.99. Okay, $9,000. What they don't tell you is what's not included in that. Of course, it's funny, but it ends up being what it ends up being. And so there's that aspect of it. And at denture wear, those are my biggest billboards out there, that denture wear, you've given permanent teeth. It's so much fun to do those, as you know. And so that is a wrinkle, but people come in and they need comprehensive care. And like you said, you only see what you know. So what CE have you done? What if you just got out of school? You haven't done any CE and you probably can't afford to do much CE. Coyce has a 2-year waiting list. 2-year waiting list. So we went when, it was, you could get in no problem. It was a lot of money, but then you left and you went, wow. And then we took it and we told the risk to the patient. And they said, what? No one has ever, if you read my 800 now 5-star Google reviews, which is laughable, but nevertheless they exist. The people say one thing consistently. I've never had I've learned more in 10 minutes with this guy than every other dentist I've had in my life. And that is sad, but true.
It's sad, but it's a great opportunity to help people. Dick, we look at this stuff and I'm talking to patients and I actually did veneers on another daughter. I've done veneers on 2 of the girls in the last 6 months. So I'm not completely, handpiece free, but I'm hoping I completely quit before my grandkids all are ready for stuff. So I'm going to send them to see you, but it really is, it's amazing. The entire scenario, the entire way dentistry is growing. Tell me a little bit about your training and your education. I know when you came as an associate 22 years ago, I think I was still doing subperiosteal implants. I was doing, I don't know I think I had kind of put the blades to the side at that point, but what was your road to, and I know you just got an award, international award on some of your implant stuff. So tell me a little bit about that.
And let me speak to your family with one little caveat here. We had interviews going on. So we had young docs coming through the office to watch and see the practice and decide if they wanted to, have this job or not. And Braden came to shadow for a day. And at the end of the interviews, people say, we want that one. And I said, oh no, he's not interviewing. That's Dr. Baird's nephew. And he's in my mentoring group. And they're like, yeah, we want him. He's really good. And he said, I know he's really good, but he's not applying for a job here. And he had never joking about that, but he's so wonderful. Anyway, sounds really great. You gave me Mish's textbook when I was a D4 demo student. I would go to the library and I'd read it and people thought, nerd. Okay. Why? And then, so I loved I thought it was fascinating, this biomechanical thing that existed, and biology was involved, but to a lesser degree, and all this stuff and how it all worked together. And so Mish was my eye-opening thing. And to hear him say all on 4, none on, soon to be none on 3. And I thought, well, that's funny. And so I would bash Palo Malo and angled implants. That'll never work, and we say, we had all these sayings, and, we were dyed in the wool Mish, and it's like Ohio State, Michigan. You're not a fan of both. That just doesn't exist. You're one or the other. And that's the way we were. And then you start seeing these cases that, 20 years in the mouth and they haven't lost any bone, and they're external hex. Like 20 years external hex. Okay, well, so there's something to it. And if someone doesn't have any other options, it is a great tool to use if they have no other options. I mean, if there's just no bone and they've worn a denture forever, it's a great option that we didn't have before that. We were putting them in parallel, and I look at my mom married the guy, of course. So he's father and stepfather, I guess, but he's my mom's husband. And I was looking for parallel on those 8, and they look like pickup sticks. But 20 years later, it still hadn't lost any bone. It's still up there doing great. And so I think, you know what? These things work if you use them right. And that's the thing, is if you use them right. And so it was Palo Malo I went over and I thought, well, I'm going to learn from the best. Like, that's what we said. I'm going to be able to afford to learn from the best. I went to Palo Malo. I went to name any guy at the top of the, Mish and all those. Carlos Martins de Rosa, this IDR. I'd never heard of IDR, immediate dental alveolar restoration. Well, so the award I won was because they said, we're going to be in town and we'd like you to put in a Norris implant. And I said, I've never put in a Norris implant, but okay, sure. So the vice president of the company is going to be with us. So it's a big deal. So they come by, they have their Norris implants. I said, y'all bring in a patient if you can. Well, they bring in a guy, this old hippie guy who's hysterical, and he does not follow rules very well. And the tooth is split in 2 with pus squirting out of it. And I said, okay, not maybe the best immediate case, but nevertheless, that's what we do. And so I took the tooth out, took one tuberosity off, rebuilt the buccal plate, took the other tuberosity off, rebuilt the distal plate, did a little sinus lift, put the implant in, put a abutment on, put a tooth in it, all in one visit. And they said, wow, you should enter this in the contest. And I said, what contest? They said, the Showcase Your Skill contest. And I said, and I'm not really big on that kind of thing. They said, no, enter it in the contest. And you win a Ferrari in the Alps, in the Austrian Alps for a day. Well, now that sounds kind of cool. So sign me up for that. And so I submitted I wasn't documenting it because they were there. So I was trying to do a good job. I wasn't taking photos, but we took a few, luckily. But I submit the stuff. Well, sure enough, I win. And I win to the big table where the big guys are. And another guy took a leg. And in India, they have mucormycosis, a fungal infection that you have to resect the maxilla. The guy lost them. There's guys walking around with no maxilla, which is bizarre, right? And so no eye, no maxilla. And the guy took his fibula and rebuilt his upper jaw and anchored it in the lateral orbit of his eye. And now they didn't take the hair off of his inner thigh skin before they made a palate out of it. So if you didn't look at the hairy palate, it was a really awesome job. And I thought, dude, you get the Ferrari if you built a jaw out of a leg. And he did. He won. So it was awesome. But they paid for our way to go, and they rented a castle and tuxedos. And so I won this silly award, but the experience was awesome. And all for we do every day. So along that was Zero Bone Loss Concepts is the most recent thing, Bruce. If you've never seen tissue adhesion to a crown, I thought that was like a cool way to say you kind of got an attachment. No, if you've never seen gums, stick to zirconia, and you cannot probe. Zero probing depth restoration. You can't probe it. You might as well go out in the gingiva and stick your perio probe out there because that's the force it holds. I'd never seen that. I didn't know that was a thing. And now that I'm getting that, we're doing that, and we're repeating that, and we're doing the protocol. And so I train the team on all that stuff. And it's cool to be in dentistry again because, man, we can make it where you don't trap any food around an implant crown, which after we eat, my wife has to go floss because of implants I did, that do not have that. And so now it's awesome. It's exciting to be in dentistry again.
That is so cool. One of the things that kind of sets you apart, and it set you apart in 2001 when I was teaching at Baylor, 2001 when I was teaching at Baylor, is there would always be a couple of guys come up to the front of the room after I was lecturing. All I was talking about was practice management, but it was Jackson Bean and it was Dr. Daxin. And Dax, I think, is an oral surgeon now, or I'm pretty sure she's
related to one. He's at least related to one.
Yeah, that's right. He is related, but Dax is over in Mansfield area, I think.
So yeah.
I haven't seen him in a while, but anyway, but they always had questions. They were always wanting to learn. And Productive Dental Mentors is what Jackson's doing. Helping guys right out of the chute, or maybe even people who've been around for a while, but just want to get some extra knowledge. I'm so thankful for you, Jackson, and all the things that you're doing and helping us with Clinical Calibration Institute. I think that we're gonna see a new way of educating, and we have to, because it's so woeful in the dental schools to pay $500,000 to come out and have done 3 crowns. That there's something wrong, and this what we're teaching now with clinical calibration, getting your whole team aligned, having mentors. That is, I believe, going to be the new wave of education in the future. And just to be able to look over the shoulder of somebody like a Jackson Bean, let me tell you, you're not going to get that experience just anywhere, because you can go to a handful of offices in the United States and find the knowledge that you guys have in your office, Jackson. So thanks so much for being on with me today. Jackson's going to be coming on the podcast more often, because I want to ask him more questions. And you can tell he's excited, and you can always tell when he's excited because he talks fast, just like me. When I get excited, I talk really fast too. So anyway, Jackson, it's been a pleasure. Thanks so much, buddy. And thanks for 23 years of just being a phenomenal dentist and a phenomenal person. So good luck, and we'll stay connected.
Thanks, Bruce. Appreciate it.
Thank you guys for listening to the Productive Dentist Podcast, and I can't wait for the next one. Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.